Stroke is the fifth leading cause of death in the United States and the #1 cause of serious long-term disability, especially in seniors over the age of 65. Every year, nearly 800,000 Americans suffer a stroke, and the consequences are life-changing. Many survivors are left unable to speak clearly, walk, or even recognize their loved ones. Families across the United States, United Kingdom, Canada, and Australia live in fear of watching their loved ones lose their independence in an instant. What's terrifying is that most strokes are preventable, and the key to prevention often starts with what's on your plate. The brain is made up of nearly 60% fat, and it demands a constant supply of nutrients, oxygen, and antioxidants to function properly. Seniors in the United States often rely heavily on processed, low-nutrient diets filled with sugar, sodium, and saturated fats that silently damage the blood vessels, increase blood pressure, and reduce cognitive sharpness. Many are unaware that the foods they eat daily may be slowly starving their brain. In fact, some neurologists in major U.S. clinics have openly expressed that they see seniors whose diets are contributing to cognitive decline faster than age ever could. Have you ever wondered why some people stay mentally sharp into their 90s while others can't remember where they are by 70? It's not always genetics. Often, it's what they've been eating for decades. Leafy greens like spinach, kale, and collard greens are absolute brain-protecting powerhouses. In a large study conducted in the United States, seniors who consumed 1 or more servings of leafy greens daily showed significantly slower rates of cognitive decline, equivalent to being 11 years younger in brain age compared to those who rarely ate greens. These vegetables are rich in vitamin K, folate, beta-carotene, and lutein, all nutrients that help prevent stroke by protecting the blood vessels and reducing inflammation. Many people think they're getting enough greens, but the truth is, the average American senior falls short of even 1 full serving a day. Some elderly patients in long-term care facilities in Canada and the United Kingdom are often served highly processed meals with minimal fresh produce, and it's having long-term consequences. Berries, especially blueberries and strawberries, are another essential tool for protecting the aging brain. The compounds in these fruits, particularly anthocyanins, cross the blood-brain barrier and reduce oxidative stress, which is a key driver in both strokes and neurodegeneration. In the famous Nurses' Health study, seniors who consumed berries at least twice a week had a significantly slower rate of memory decline. The powerful antioxidants in berries improve blood flow to the brain, help regulate blood pressure, and decrease the buildup of plaques that can lead to both Alzheimer's and stroke. Unfortunately, many American seniors believe fruit is too high in sugar and avoid it completely, missing out on one of the most protective natural medicines available. Even in Australia, where access to fresh produce is better, consumption among older adults remains lower than ideal due to cost and convenience. Fatty fish such as salmon, sardines, and mackerel are among the richest dietary sources of omega-3 fatty acids, especially DHA and EPA, which are absolutely vital for brain health. And vascular protection. Multiple large-scale studies from both the United States and United Kingdom have found that people with higher blood levels of omega-3s have significantly lower risk of stroke, better memory, and even larger brain volumes in old age. Omega-3s reduce blood clot formation, lower triglycerides, stabilize heart rhythms, and support the integrity of cell membranes in the brain. Seniors who consume fish just twice a week have better executive functioning and slower brain aging. Yet, the typical senior diet in many U.S. households is sorely lacking in these healthy fats, often replaced with fried or processed meats. Even in retirement communities in places like Florida or Arizona, where nutrition services are offered, menus often rely on convenience over nutritional density. Nuts and seeds, particularly walnuts, flax seeds, and chia seeds offer powerful stroke-fighting and brain-boosting properties. Walnuts are particularly rich in alpha-linolenic acid, ALA, a plant-based omega-3 fatty acid, and have been associated with better cognitive test scores among seniors. In one study conducted in the United States, participants who regularly consumed walnuts performed better on tests of memory, concentration, and information processing speed. Seeds like flax and chia also provide fiber and magnesium, both of which are crucial for maintaining healthy blood pressure, a major risk factor for stroke. Seniors who struggle with chewing or dental problems can blend these nuts and seeds into smoothies or add them to soft foods like oatmeal to make them easier to consume. Still, many seniors avoid nuts due to outdated fears about fat content, even though the fats in these foods are among the most protective ones you can eat. Whole grains such as oats, brown rice, quinoa, and barley are rich in fiber, B vitamins, and antioxidants that help support brain and cardiovascular health. Fiber in whole grains helps regulate blood sugar, reduce cholesterol, and improve blood flow, all essential factors for stroke prevention. Research in both Canadian and American senior populations has shown that higher whole grain intake is associated with a lower risk of ischemic stroke, the most common type. Despite this, the standard diet in the United States still favors refined grains like white bread and white rice, which have the opposite effect, contributing to blood sugar spikes and inflammation. Seniors on fixed incomes may choose cheaper, processed options, unaware of the long-term damage these foods are doing to their brain and arteries. Avocados are one of the few fruits that provide monounsaturated fats, which help improve cholesterol levels and maintain healthy blood pressure. They are also high in potassium, even more than bananas, which is critical for reducing stroke risk. Potassium helps relax blood vessels and offset the effects of sodium, which most Americans consume far too much of. Seniors in the United States who eat avocados regularly often have better vascular function, and some studies even show enhanced cognitive function. The smooth texture and mild flavor of avocado make it easy to include in meals for those with poor appetite or dental issues common among older adults. Beans and legumes, including lentils, black beans, chickpeas, and kidney beans, are underrated heroes for senior brain health. Packed with plant-based protein, iron, magnesium, folate, and fiber, they stabilize blood sugar and support vascular health. Folate, in particular, is essential for preventing homocysteine buildup, which is linked to higher stroke risk and cognitive decline. A clinical trial in the United States involving seniors who added just 1 cup of beans per day to their diet showed improved cognitive function over a 6-month period. However, in nursing homes across the United Kingdom and Canada, legumes are often left off the menu due to preparation time, which deprives residents of this powerful nutritional ally. Dark chocolate, when consumed in moderation and with high cocoa content, at least 70%, delivers flavonoids that enhance brain blood flow, improve mood, and reduce inflammation. In the United States, a study published in a major neurology journal found that seniors who ate a small amount of dark chocolate several times a week had improved memory and reaction times compared to those who didn't. The theobromine in chocolate also stimulates the brain, making seniors feel more alert and focused. Of course, many chocolate products in American grocery stores are loaded with sugar and unhealthy fats, which cancel out the benefits. Seniors and caregivers must be educated to choose the right types of chocolate to truly gain its brain-supportive effects. Eggs, particularly the yolks, are one of the best sources of choline, a nutrient essential for building acetylcholine, a neurotransmitter involved in memory and learning. Choline deficiency is shockingly common in the United States, especially among older women, and it can directly contribute to cognitive decline. Eggs also provide high-quality protein and healthy fats, which help stabilize energy levels throughout the day. Many U.S. doctors used to warn patients to avoid eggs due to cholesterol fears, but current research confirms that moderate egg intake does not increase stroke risk in healthy individuals and may actually improve brain function. Seniors who include eggs in their breakfast regularly often report better mental clarity and less brain fog. Tomatoes are a rich source of lycopene, a powerful antioxidant that supports heart and brain health by neutralizing free radicals that damage cells and blood vessels. In studies conducted in both the United States and Canada, seniors with higher blood levels of lycopene had a significantly lower risk of stroke and better cognitive performance. Lycopene is especially effective when tomatoes are cooked, such as in sauces or soups, which helps release more of the compound. Many older adults underestimate the benefit of adding something as simple as tomato-based dishes to their weekly meals. Even a serving of tomato soup or baked tomatoes a few times a week could make a measurable difference in vascular health, especially when paired with healthy fats like olive oil. Unfortunately, tomato-based products in most U.S. grocery stores often contain added sugars and excess sodium, so seniors and their families must choose clean, low-sodium options or make their own. Turmeric, with its active compound curcumin, has been studied extensively for its anti-inflammatory and neuroprotective properties. Chronic inflammation is one of the major drivers of both stroke and neurodegeneration, and turmeric has shown in human and animal studies to directly reduce markers of inflammation and oxidative stress in the brain. Seniors in the United Kingdom and Australia have increasingly incorporated turmeric into their diets, often in golden milk or capsules, to help preserve brain function. In the United States, however, it is still underused among seniors despite growing scientific evidence. In one clinical trial, seniors who took a curcumin supplement showed improved attention and working memory within just weeks. Those who consumed it long-term also had better brain scan results and reduced amyloid plaque buildup, the type associated with Alzheimer's. Adding turmeric to soups, stews, or tea is one simple way to take advantage of its incredible protective benefits. Extra virgin olive oil is a staple in the Mediterranean diet, which has been repeatedly proven to lower the risk of stroke and cognitive decline. In a landmark study funded in part by U.S. research grants, older adults who consumed olive oil as their primary fat source had 41% lower risk of stroke compared to those consuming other oils or margarine. Olive oil is high in monounsaturated fats and polyphenols, which improve blood vessel function, reduce inflammation, and help stabilize cholesterol. Unfortunately, many seniors in the United States still use vegetable oils or butter because they are cheaper or more familiar, unaware that even small daily amounts of olive oil could protect their brain and arteries. For best effect, olive oil should be consumed raw or gently heated, not fried, to preserve its beneficial compounds. Green tea, long consumed in Asian cultures for its healing properties, contains catechins, antioxidants that cross the blood-brain barrier and enhance brain plasticity, memory, and circulation. In studies involving elderly populations in Canada and Australia, seniors who drank green tea daily had a reduced incidence of stroke and improved cognitive test scores. A study from a Boston-based research hospital found that green tea drinkers had reduced arterial stiffness and better blood flow to the brain, a key factor in preventing both ischemic and hemorrhagic strokes. Many U.S. seniors are more familiar with coffee, which also has benefits in moderation, but green tea offers a gentler, sustained energy and contains L-theanine, a compound that promotes calm focus, something that can be valuable for seniors dealing with anxiety, confusion, or cognitive fatigue. A cup of green tea in the morning or after meals is one of the easiest habits to build for long-term brain protection. Beets are rich in nitrates, which convert to nitric oxide in the body and help relax and widen blood vessels. This enhances blood flow to the brain, lowers blood pressure, and reduces stroke risk. In one US-based study involving adults over 60, those who drank beet juice showed improved blood flow to the frontal lobes of the brain, regions responsible for decision-making and memory. Beets are also rich in folate and fiber, both of which support vascular health. Seniors often avoid beets due to their earthy flavor or because they don't know how to prepare them. Roasted, pickled, or juiced, beets can be included in meals, several times a week. In Canada and Australia, beet-based products like juice shots and powder have grown in popularity among health-conscious older adults trying to preserve brain function naturally. Fermented foods such as yogurt, kefir, sauerkraut, kimchi, and miso are gaining attention for their role in the gut-brain connection. The gut microbiome directly influences inflammation, mood, and cognition through a complex interaction with the central nervous system. Research from major hospitals and universities in the United States has revealed that seniors with a healthy balance of gut bacteria perform better on memory tests and are less likely to experience depression or brain fog. Fermented foods help restore healthy bacteria, support digestion, and reduce systemic inflammation, which is linked to both strokes and dementia. Still, many older adults have never been introduced to these foods. Processed yogurt brands in the US often contain added sugars that cancel out the benefits, so choosing plain, unsweetened versions is crucial. Caregivers and nutritionists in senior homes in the United Kingdom have started introducing more fermented vegetables to meals to support both digestion and mental clarity. Garlic, especially when consumed raw or lightly cooked, supports cardiovascular health through multiple mechanisms. It reduces blood pressure, inhibits platelet aggregation, which reduces clot formation, and lowers LDL cholesterol. Several US-based meta-analyses concluded that garlic supplementation can reduce stroke risk in hypertensive patients. For seniors already on blood pressure medication, garlic may enhance their effects naturally without side effects. It also contains sulfur compounds that reduce inflammation in both arteries and brain tissue. Many older Americans only use garlic as seasoning and rarely in the quantities needed for therapeutic benefit. Eating 1 clove daily or adding crushed, fresh garlic to salads and dressings can significantly improve vascular resilience in the elderly. Pomegranates are rich in polyphenols that reduce oxidative stress and support blood flow. Studies show that pomegranate juice can lower blood pressure, reduce LDL oxidation, and improve brain perfusion. In a double-blind US clinical trial, seniors who consumed pomegranate juice daily for 4 weeks showed improvements in verbal memory, and MRI scans revealed increased brain activity. These effects are thought to be related to improved blood flow to critical brain regions. Many seniors avoid fruit juices due to sugar content, but unsweetened pomegranate juice or small servings of seeds can offer powerful protection against stroke and mental decline. In the United Kingdom, several hospitals have incorporated pomegranate extract supplements into rehabilitation plans for post-stroke patients with impressive early results. Water is the most overlooked but essential nutrient for brain and stroke prevention. Dehydration leads to thicker blood, which increases the risk of clots forming and raises blood pressure. Seniors in the United States are at especially high risk of dehydration due to reduced thirst sensation, medications, and mobility issues. In one large survey, over 37% of seniors admitted to hospitals in the United States were found to be dehydrated, which directly worsened outcomes in cases of stroke and cognitive impairment. Chronic low hydration leads to confusion, fatigue, and slower processing speed. Encouraging consistent fluid intake, especially water, herbal teas, and broths, is a low-cost, high-impact way to protect the aging brain. Using clear visual reminders and flavor enhancers like lemon or mint, can increase compliance among elderly patients who say they don't feel thirsty. Cinnamon, often overlooked as just a flavor, contains bioactive compounds that regulate blood sugar and improve circulation. In studies across both the United States and Canada, cinnamon has been shown to improve memory, reduce inflammation in the brain, and lower fasting glucose, all key factors in stroke prevention. Just half a teaspoon a day, added to oatmeal, tea, or yogurt, can support better blood vessel function and mental alertness. Seniors with diabetes or insulin resistance, both of which increase stroke risk, can benefit significantly from including cinnamon in their daily diet. Yet many still consume store-bought baked goods with cinnamon flavoring instead of the real spice, which provides no benefit and only adds sugar and processed fats. Even onions, rich in flavonoids like quercetin, offer brain protective benefits. In several studies conducted in both American and Canadian populations, higher onion intake was associated with better endothelial function and reduced inflammation in elderly participants. Onions also help reduce the risk of blood clotting and support detoxification pathways, making them valuable for stroke prevention. Sautéed, grilled, or raw, they're a simple addition to almost any savory dish, but their strong flavor leads many seniors to skip them. Offering milder options like shallots or green onions may make it easier for those with sensitive palates to include them.